So whatever the level of the efficient price determined will be contentious. We've already given the states and territories and the Commonwealth a figure. We gave them a figure on the 28th of March, and of course, Commonwealth says it's too high. States say it's too low. But we will set a final figure. We're waiting on some iterations from the jurisdictions, and in fact some submissions due today. Mary, looking forward to it. Give me something to read tonight, keep me up all night. And we will make some final tweaks in the coming days, and we have an authority meeting on the 30th of May, and we hope to publish soon after that. We might have to have a second authority meeting if we have to. Whatever happens, there'll be a very significant increase in transparency. And you remember, this is what our First Ministers wanted. The Prime Minister, the Premiers and Chief Ministers, the reason why they wanted activity-based funding is to bring more transparency into the system so we can know where money goes and what we get for it. And I'm already seeing, and I'm sure you've probably noticed locally here yourselves, there's a very significant elevation in interest, even in jurisdictions that already have activity-based funding, Victoria and South Australia. Very significant elevation in interest as to what exactly their money is buying or used for at local level. And we're already seeing an intense interest in our methods and calculations, but it's not only occurring at jurisdictional level, it's occurring at local level as well. So you will notice, if you work in the system, a very significant increase in transparency. My wife's a journalist, so she's eagerly awaiting the publication of league tables. I told her that she might just have to wait a bit, but it will be very clear very soon in July, June, July, where local hospital networks sit with respect to the national efficient price. We've got a debate inside our authority. I'm governed by a group of 9 authority members, and they will debate soon exactly how they publish that information. But they will publish something. So there'll be a very significant increase in transparency and debate about where cost goes in the system. It'll be a lot clearer where Commonwealth money is going, and hopefully the Commonwealth Government and others will be assured as their objective of transparency is met. But it will be very clear much clearer where that money goes at local level across the country in the near future. And it'll also be a bit clearer where state money goes as well. And now New South Wales has published for many years its budgets at local levels, but not every jurisdiction has been doing that. So it'll be a lot clearer across the country exactly where state money goes within each state as well. So there'll be a very significant increase in transparency, debate, discussion around costs of hospitals in the coming weeks. I expect you'll see an elevation in June, July, quite significant elevation. And of course, we're already noticing ministers, not only your minister, but other ministers around the country, are starting to ask us a lot of questions about exactly where their system sits compared to others. New South Wales is numerically in a good position. You're a third of the country, so when I talk about our pricing regime, you'll see in the early years you're automatically nearly set the price because you're a third of the country. But other jurisdictions are in intense discussions with us at the moment around how the system sits with respect to the national efficient price. And those discussions will intensify in the coming weeks.